In the beginning of the year, I remember just observing Oliver having to kind of move a lot around the classroom. We had a bench in our rug area that he would kind of slide his body along and like down and then back up, and he would kind of do that over and over again. He often would leave the classroom during like academic periods and kind of still walk around the classroom instead of like sitting in his seat to do work.
In April, we took he took the alternative assessment. So we talked with you all and weren't convinced that he would be able to sit through the state test or the alternative assessment that we had planned. He shocked all of us.
Yes.
He sat there for an hour and a half working really diligently, totally engaged, said, "Can I take this home? Can I keep working on this? Are we having the test again tomorrow?" And he just sort of defied our expectations.
My name is Dr. Eugene Charles. I'm a doctor of chiropractic and applied kinesiologist. And Ollie has been coming to me for about 2 months now. And he was given a diagnosis of attention deficit disorder, or ADHD. When I first started practice, it used to be called dyslexia or hyperkinesis. I'm sure before I finish practice, it'll be named something else. And I'm going to keep treating it the same way because I don't treat the condition. I treat the person with the condition. And I found in my 30 years in practice that it's basically a functional problem. The brain, we've now learned, is very plastic, they call it, that it can actually model, that we can continue to make new brain cells and change pathways. It used to be thought that brain cells didn't regenerate and it was very rigid like a model, and it's not true. It's very pliable, and brain cells, neurons, pathways can all change, especially when you're young. So Ollie first came in, and you could tell he's a very intelligent kid, and I say this with a lot of boys, since the diagnosis is more with boys, that they're usually highly intelligent. And I often tell them they were like born with a Ferrari, but nobody taught them how to drive it. Then they get more frustrated, and they crash into walls, and they cause trouble. And it's not really a problem of deficit, it's a problem of like too much, and they don't know how to handle it.
I knew the task was something Oliver could do. I didn't think he was gonna be able to actually sit through the assessment. When the first day happened and the woman that works with him was just like, no, he sat there, he finished it before the rest of the kids, and he was fine. Like I kind of was like, are you sure? Because I really didn't believe that it was gonna happen for him, and it was really nice to see that he could sit through that.
Yeah, we were shocked, but everybody was thrilled.
I work with the nervous system, and I make sure that they can receive and transmit information. In kinesiology, we find it's a problem with processing information, because while the nervous system controls every muscle, gland, and organ in the body, it really just does two things. It receives and transmits information. So it receives it, it processes it, and then it sends it out. So I work with the processing, the CPU of people.
He's become more aware, I think, of what his body needs. I really want to say around maybe like after February break or around March, he's been able to request breaks more. Part of his school plan is for him to have breaks when he needs to. That means he could have to go take a walk, he could do a movement break with the parent in our classroom or with a partner. And in the beginning of the year, you could physically see that Oliver needed a break. He knew he needed a break, but he wouldn't ask for one.
So even when Ollie first came in, he even had his pants on backwards. And this is a very common thing. I'll have patients come in, young or older, and I'll say, okay, lie face down, and they go face up. Or I'll say, turn to your left, and they turn to the right. Now, this is a sign of what we call in kinesiology neurological disorganization. It's just a problem really of a sensory overload, which in this day and age is very, very common. So a lot of times people will get into this disorganization and they might get out of it, but they might not. And that's where I come in. When Ollie returned for a second visit, the first thing I noticed is his pants were on right. And then I could also see he had a little less of that hyperactive energy, a little defensive was there. And then when we worked on him again, I didn't have to do his skull as much, so I worked some other muscles, and he had so much tension. When I was working some reflexes we use for the brain in kinesiology, he was ticklish and running all over the place and squirming, And I've explained to him, I go, ticklish and pain are the same thing to the nervous system. It means there's congestion, there's something not right there, and he grasped that. So I can see how sharp he is. And as I use the Ferrari analogy often, he has all that there, and it has trouble getting out, and it leads to frustration, and all that energy gets blocked up.
He would get frustrated and he would fatigue very quickly, and I couldn't really tell where his reading level was at the time. And the fact that he was able to read 2 articles and take notes on it and then write a clean paragraph that expressed the differences and similarities between the animals he read about, that was amazing. Because it was not something that he'd been able to demonstrate before. Everybody had this idea that Oliver was that bright, but we couldn't see it because we had no documentation of it. And that was the first time we were really able to get something down.
When Ollie came for his 3rd visit, and I started treating him and working on him, he started stretching in the middle of the treatment. And that tells me, again, tension is being relieved from his body. When range of motion improves, when flexibility improves, when he starts yawning, when he starts stretching. And then the 4th time I saw him, I was running up and down his spine with a percussor, a very wonderful device to take tension out of the body. And so when we were running up and down the spine, he went from squirming to just, all those 4 different things, the range of motion, the yawning, the stretching, the lack of tickling, are signs that we're making positive changes in this young man's nervous system. That can only be good, and since the nervous system controls every muscle, gland, organ in the body, he is going to be better, feel better, and do better with this kinesiological, with this natural therapy that we're doing.
Dianthe, the principal, mentioned that he, how engaged he was in a meeting in front of the whole entire staff.
Yeah.
It was that sort of, it had that sort of impact.
And what really I think is wrong is we take a boy like Ollie, who's obviously highly intelligent, who has all this energy, and we expect him to sit still for 8 hours, not have an original thought, and just sit like an automaton or a robot. I don't agree. I think it stifles individuality within reason. I mean, we all have to play within the rules, but I don't think we have to keep getting it smaller and smaller and smaller. We have to give people room to grow. That's what made this country great, as far as I know, individual achievement while staying, of course, within an interdependent and productive society.
Just the other day, we were passing out work from over the course of the year, and Oliver kept saying, "But where's mine? But where's mine?" And the thing was that at the beginning of the year, he didn't really do any work. And so he was surprised to see that, wow, I have nothing for the first 3-4 months of this school year. All I have is the work that I've done over the past few months. So I think he was really proud of himself for what he had done, but I think that it was shocking to him, the difference.
So what I do, what applied kinesiologists, chiropractic, massage therapists, nutrition therapy, all these things are natural. They work with the body. The body wants to be healthy. Get the different nervous tension worked out of the body through the spine, through the muscles, by releasing the jaw, which is a very powerful receptor-based thing for the nervous system. Get this natural therapy done. And like I've said before, what if I'm not right? Well, everything I'm doing is healthy anyway. I challenge anybody to say, oh, the things you're doing, oh, they don't work, they're doing this. All right, I won't even argue with you. Are they good for you?
Whatever is happening for him physically, he's become more aware. And because he's become more aware of what he needs, and he's better able to verbalize that. And it keeps him in our room, it keeps him focused on what he needs to do. There are still times where he has difficulty sitting through a task, but he's better able to say, I can't do this right now, instead of kind of losing it and needing to leave the room.
And I would say as a result, he's happier in school. Yes. He didn't like coming to school before, but now he runs into the room and he smiles and he laughs, and it doesn't feel like he's in crisis like it did at the beginning of the year.
Yes.
I believe natural therapies are the way to start. I don't think you should just start throwing chemicals, all of which have a reaction. Now, I'm not saying it's never needed, but why not start with natural therapies? That's what I always feel. My father, who was a mechanic, taught me something. When something's not working in the car, replace the fan belt before you replace the entire engine. And I feel with people, before you start medicating them, try these natural therapies. Try the kinesiology, the chiropractic, the massage, the meditation, the exercise, the healthy diet. Try it first. You're just going to get healthier, and I'll bet it'll actually take care of the situation. Albert Einstein, it was well known, he was not good in math at first. He was a daydreamer. If he was born here and now, they would have thrown Einstein on medications, and I believe we could have lost the greatest mind of the 20th century. Well, I'm here to do my work to make sure we don't lose the greatest mind of the 21st century.